we're going to talk a bit about digital health, and in particular, why the time is right for digital health. Now, that's a bit of a sort of a flashy way of saying, like, now's the time, let's do it, but it's actually driven by a lot more than just an ambitious view of the future, but by a necessity. So I know that a lot of people are going to spend some time on social media tonight, etc. So for those, I've given a short version of the entire talk, okay? Number one, where are we at right now? We're in trouble. We're in big trouble. Where are we heading? We're actually going off a cliff when it comes to our healthcare systems, from a cost, from a productivity, et cetera point of view. Is there any hope? In hope, perhaps in digital, we hope so. What is digital health? Well, we're starting to see some themes emerging, which really is going to be the bulk of what we talk about tonight. Are there risks and challenges? Of course there are. I'll start with the current state of healthcare. Now, I'd actually like to keep this relatively conversational. There's not that many of us here. The first block of this is going to be a few graphs, not too many, and we're just going to dive into sort of what is the problem. And then we'll shift into these themes as I talked about and start to be, it's quite example heavy, so people can start to understand from real world examples about what we think the future might start to be able to look like, and hopefully stimulate both conversation and also thinking in your guys' heads about what are the opportunities here. It really is quite a broad open space. So as I mentioned, let's start. The current state of healthcare is not good at all. We're currently spending over 10% of our national GDP in Australia. That's rolled out everywhere on healthcare. These costs are both growing and accelerating every year. This is the last 20 years per capita expenditure in Australia. That's the US, and that's globally. Okay, so we're over doubling every 10 years now, and that is accelerating. So this is primarily driven actually by chronic disease. I don't know how many people here fully understand the differences. When we really talk about chronic, we're talking about a set of diseases that are non-communicable, and you have for a long time, meaning forever. Okay, so it's more than 40% of Australians, half of Americans, 25% of Americans actually have 2 or more chronic diseases, which is a massive problem. Again, growth rates are accelerating. It is by far and away the biggest driver of death, the biggest cause of death everywhere. It's driven by primarily aging populations, but sedentary lifestyles, diet changes, obesity, etc. These are the main culprits when we talk about chronic disease. We're talking about hypertension, which is high blood pressure. We're talking about hyperlipidemia, which is cholesterol, then into our arthritis, heart disease, diabetes, etc. These are the millions of sufferers in the US. The costs are overwhelming. It's 84% of total healthcare spend in the US is on chronic. We're already burning $35 billion a year in Australia, and diabetes alone is costing 1 in 9 health dollars spent globally. So it's $615 billion a year currently just on diabetic care. So when we talk about healthcare, we usually think about the acute side of it. You break an arm, you get sick, and all that sort of treatable stuff, but it's actually driven by a lot of stuff around population, a lot of stuff around developing, world developing. And chronic disease is actually this silent killer. And the costs are phenomenal and growing. This is the same ones as broken down by the cost. So heart disease is huge. Diabetes is huge. It's getting worse. We're 53% per year. It estimates this may be high, but we're talking $47 trillion by 2030. The growth is accelerating everywhere, but particularly around China and India and Africa. So again, this is changing, developing world, and it's changes to lifestyles, changes to diet, etc. And so this is actually a time bomb, and it's unsustainable. So this is the cliff that I was talking about. We're about to drive off it pretty quick. We cannot afford to do this anymore, and the whole health system is utterly incapable and not set up to actually deliver chronic management. It's set up for acute care. Cost is growing, is high and growing, the population is exploding, and ultimately the whole system is about to break. Okay, so that's the downside. So ultimately we have to do something. So acute care is something whereby you come in, or at least as I'm defining it for here. Acute care is something you come in, you're sick, you break your arm, you come in, you get treated. That treatment has a program, and then essentially it ends. right? As opposed to chronic, which, at least as I'm referring to it, it's something you have forever. It's diabetes type 2, right? You go in, you end up with a diagnosis, and then you have it, and you have it for a long time, and the vast majority of the care is at home by yourself, rather than specifically clinical. I realize that's a simplistic view of it, but I think it's relevant for the separation between how we think about setting the system for healthcare right now versus where the problem actually is lying. So we have to do something. Now, in parallel to all this sort of stuff over the last 10, 15 years, we've seen the spread of digital enablement change just about every other industry that we have in our society and in our economies. Everything from retail, social, health, education, financial services, et cetera, we're all sitting here with mobile phones, and every one of them has changed the way we live and interact with most services. Healthcare has come along incredible leaps and bounds in terms of its therapeutics, in terms of keyhole surgery, in terms of the ability to use technology to treat problems. But there's a whole range of interaction elements between consumers and the health system, which has not actually fully realized the advantages of digital as it stands right now. Now, most of these changes in other industries have been both driven and fed into a set of sort of infrastructural digital platforms. These are all these things that everything is built on top of. So this is the data network, right? Mobility and mobile phones, cloud computing and storage, and also sensors. And sensors isn't just the GPS, but it's also the microphone on your phone, it's the camera, et cetera, et cetera. So this has driven everything you see from Snapchat to Tinder to Uber, et cetera, is all predicated on these platforms, or these sorts of enables, infrastructure they almost are now. Most of these apply directly to health as well. And if we can, the dream is if we can start to really take this approach and start to take these drivers and apply them to healthcare, then we can start to look at advantages such as unlocking information, empowering patients, distributing the system, enabling real-time, data-driven analytics, and a focus on prevention. Now, when we apply these drivers to health, I think there's about 6 key themes that I want to talk about tonight in terms of what we're looking at. And it's important to note I'm very much focusing on the consumer side of this. There is fantastic work happening, as I said, around the technology of medtech, around the therapeutic care, and also around the IT. Even though it's a very hard problem, there's all sorts of good stuff happening around identity, integration of data, security of data, et cetera. For a talk on a Thursday evening, I think we're going to focus on the consumer side of it. It's a little sexier, it's a little more fun, it's a little more visual, rather than a big long screed about interoperability standards amongst EMR systems. So these are the themes that we're going to dive into. We're going to start with, I think, telehealth. Now, I think this is perhaps the most advanced and easily articulated proposition of a theme of digital health and how it ties together. It actually leverages a lot of the other themes we're going to touch on. And I think that this is sort of understandable as a way of figuring out and getting how can all those digital enablement tools we talked about apply to healthcare. Now, there's just a definition, which is the provisioning of healthcare services across non-clinical and distributed environments. There's 2 main benefits that we think we can grasp from this. Number 1, of course, is reduced cost and effort. So from the care provider perspective, the ability to be able to deliver services, deliver real quality health care, like equal quality health care, without necessitating a physical visit, obviously has phenomenal impacts on terms of the cost for care providers, but also the non-financial necessarily cost for both older patients and chronic patients. Often, it's arduous, it's hard, it's expensive to go see a doctor, and for a lot of chronic specific things, it's actually unnecessary if we can manage to deliver a certain set of services remotely. Okay? Taking it perhaps a full step farther beyond cost savings and convenience is improved access to care. The ability for people who are not able to get to clinical facilities because they're in remote areas or they're in the developing world, the impacts are phenomenal. They're huge, right? Be able to give people access to care that right now, quite frankly, they simply are not getting. So From now on, for each of these, I'm going to dive into a bunch of examples, right? So we can talk about it. Feel free to interrupt and ask about specific ones. You guys may have your own from your own experiences. Please let me know. We're going to start with a little eye candy at the start. This is a great example of a remote medical test and diagnosis. So these guys, Triggerfish, have created contact lenses with a sensor on it and an antenna that is able to do glaucoma testing. So it's able to test the eye pressure remotely. You put it in, it connects either to a patch that you wear as the antenna and then through to your phone, which is then able to transfer that information over a continuous longitudinal 24-hour back to home base, so to speak. So back to the provider. Glaucoma is a massive issue around particularly developing things. It's very much driven by lack of access. And this is a way of sending out, it's cheap, it's disposable, and it just sort of encapsulates the ability to deliver a little bit of hardware to people driven by data, analytics, and having somebody be able to run a test from a laptop or a computer desktop for people all over the world. So it's a great example. This one is equally a little far out. These are ingestible sensors. So we're now at the point of a little pill. It's wrapped in magnesium. You swallow it. The electrolytes in your body will break it down and activate it. It then sends the information back to this patch, which is a little battery-powered patch you keep on yourself, which has a Bluetooth chip, runs it through your mobile, and back to home base. So this is, again, the ability of a deliverable system to put sensors inside of people's bodies to measure whatever. Again, the total cost of this thing, sensor, the patch, a few bucks. Right, so you're starting to get the idea of when you start actually distributing things that happened before, only when you were in a clinic everywhere in the world cheaply and easily, based on the ubiquity of data networks, mobile phones, and sensors, and the cheapness of it, then you start to see the possibilities here. This is another one I love, to be honest. This is HearScreen. These were created by a South African group. They're doing clinical quality ear tests or hearing tests, again, distributed throughout Africa to be able to allow anyone with a mobile and the app to be able to run hearing tests, and it's of a quality of being able to go in. Again, distributing it through people. This one's huge on access and letting people who didn't get it. Obviously, the implications are actually have a lot of impact around education because kids can't hear, they fall behind, they don't know it's because they can't hear, and there's sort of a cycle of this sort of things happening. It doesn't happen in the West. It happens in areas where you have remote testing, and there's a lot of this around Aboriginal communities in Australia are starting to use things similar to this. Another eye test one, which I find kind of cool, which is a snap-on device for a phone, which is able to do eye testing and be able to look at health of the eye. Again, important for older people for this continuous source of checking. This one is, I guess, a bit more traditional sort of video telehealth. So this is a Mexican crowd who are doing called WeDoctors, who it's 24/7. You on your phone or your laptop, you press the button, you get access to a practitioner. And the nice part of it is they're then able to provide an e-prescription, so to speak, by email at the end of it. So again, and this isn't for when you break your arm. This is for when your kid has a cough, right? And you don't have to get in the car and drive to A&E because of it. This is a similar model driven for mental health care. Now, this is Ginger.io. So what's cool about this is it's a pretty standard chat interface, but what's really interesting here is the analytics behind it. So we're going to touch on a lot of these sorts of things that are driving into this, but the analytics of being able to monitor and understand the semantics around conversations and start to build out patterns around how people behave and where their mental state is at. I don't have it in here because it's very early, but I have friends in the UK who are building out apps on the phone so that they're measuring voice when interactions, so when they're talking on the phone and that, and measuring for early onset of Alzheimer's and dementia, and knowing when people are starting to get stressed, et cetera, et cetera. So it's fascinating the ability from the machine learning element in the background to be able to start to analyze patterns and understand and be able to deliver services along that. Okay, so I split out something called remote health monitoring, which I'm personally interested in. Now, this could quite easily fold into, it's a feeder for telemedicine, but I think it's a different thing. Mostly because, so this is the ability for people to gather and aggregate their health and wellness data outside of the clinic. Now, this is quite different. Those other ones are tests that used to be able to happen when you went to a clinic or a doctor that is distributed, and you can see the advantages there. This is different. This is the ability for people to be able to gather continuous data about themselves at home longitudinally, meaning over periods of time. That's new. Okay. There's a number of examples I'm going to show about the data that can be collected and what we're going to be able to do with it. Impacts, obviously, for a health system operating model are huge. If this were to explode, of patients and not as much time with data. If that flipped and we started to see a bunch of people being remotely monitoring, then the operating model around analysis of that data and analysis of changes to normal behavior, so for example, heart, right? That fundamentally changes how hospitals and how the health system operates. The volume and nature of patient data and analysis is something we've never seen before. I have an example of something similar about a stethoscope for the phone. So it was a snap-on case for the phone that you could do photocardiograms. So you was able to, had a little thing on it where you're able to measure the sound. So it was the equivalent of a stethoscope, right? So rather than going to the doctor or the cardiologist and having that, they were sending them home, and then the person had us on a schedule to be able to take one of these every 2 days. Something like that, right? So now the doctor, instead of having to see this person every week, he sees them every month, but the time is spent looking at that person's data, right? So it's the same doctor. Now, absolutely right, the operating model around how you distribute that changes as well, but the fundamental job of a doctor of visiting somebody and then doing analysis starts to shift when, if you can reduce the number of visits, you have less people coming to you, but their data exists, so you're able to monitor them remotely rather than necessarily physically. Significant changes. Do we know the impacts? No. It's pretty big deal. The volume and nature of the data, that is exponential growth of volume of data that no system anywhere has ever dealt with before, and we have no idea how we're going to manage it, right? The type of data changes as well, because it's no longer just event data, which is discrete, right? It is continuous, so it runs over time. So we can start to understand patterns. It's very pattern and pattern exception analysis rather than a specific moment in time analysis. What that means in terms of medical diagnosis, again, we're not sure yet. We haven't had these volume of data before, but the impacts of it are pretty significant. Cost and reimbursement models obviously change if you're not going to the doctor, but you have a piece of hardware that you've taken home. Who pays for it? Who continues to pay for it? Who replaces it, et cetera? Again, all these things start to get shaken, and we have to start to refigure them out if we start to change the way that we manage care. So this is an example. This is not the Steth.io guys I mentioned, but this is actually originally an Australian-US group called AiCure. This is an EKG monitor. It's, again, snips on the back of the phone. It's got 2 electrical pads on the back, and you put your fingers on it, and you can get EKG monitoring, along with the blood pressure, et cetera. So again, the model being, go home, do your own EKG monitorings every 3rd day or every 2nd day or whatever schedule is relevant, and that data piles back into the home base of it rather than coming into the doctor every 2 months to get a new one. So one of the things we'll talk about later is the regulatory elements of this, right? So this, for example, is FDA approved. So from an accuracy perspective, most of these things still have to, when they are medical, they still have to go through the standard regulatory channels, right? Now, how is the regulatory system managing the explosion of innovation? That's a massive question, right? We're not sure, but as it stands right now, it has to go through the same gate, at least in countries with strong regulatory bodies, which does not include a lot of the countries we talked about where we're seeing the explosion of the problem. So again, all these questions are being pressured, right? This is a nice one around asthma management. Asthma, obviously, is often caused by environmental factors, so it's contextual. So this is just a nice little piece of hardware. You're monitoring when you're taking your things, and this is all apps and insights driven. So you start to say, okay, this is where I get my asthma attack. This is when I'm taking it. Here's the effect, et cetera. They claim 79% fewer asthma attacks and 50% more symptom-free days as a result of people understanding the context of when their attacks happen, et cetera, et cetera. This one's quite simple, but actually quite nice, right? It's just a blood pressure monitoring system. It's pretty. It looks nice. One of the things about chronic is, I don't know exactly, but I think like heart is, if you've had heart failure, you have 50% chance of having another heart issue over the course of the next 3 years or something like that. So most chronic diseases, when you come in, this is what I mean about you're in and out. You're constantly sort of involved with this thing. I know diabetes best. It doesn't go away, right? You have it. You have type 2. You have to deal with it. You have to make it manage with your lifestyle, or you can ignore it. And if you ignore it, there are major implications. hence the massive growth of complications and the massive growth of costs up to hundreds of billions of dollars. A couple more on remote monitoring. I've said this a few times, but this one is actually probably my favorite. So this is a good example of a wearable that is doing monitoring, which is linked up to an alert care service on the back end of it. So this is an epilepsy monitor. You put it on, it measures the microtremors and is understanding of future seizure. So before it happens, before the person is aware of it, it's measuring it, and then the beauty is it's able to then send alerts and start to trigger a response from the care circle. That could be professionals, could be family, friends, whoever is relevant. So when I say digital, I really mean that whole stack of being able to understand people, build it cheaply, put it on a network, and then distribute it via services, all driven through mobile. You guys probably saw this one at some point. This is Verily, which is Google's life sciences division. These are glucose monitoring contacts. These are not in market. They're probably a few years away. But these are the idea of having contacts which are measuring your glucose all the time. So again, specifically targeted for diabetes. And interestingly, the third time we've seen the eyes as an API for the body, right? Starting to be able to connect with the eye and start to say, how do we start to mediate senses and understand things through this sort of orifices? This one is a SkinVision. I guess it's pretty relevant for us in Australia. Again, using the image sensor on the phone to take pictures and analysis of skin lesions and moles, etc. Skin cancer and other diseases of the skin sort of progress over time. They grow chaotically. So the ability to sort of constantly at home monitor a skin lesion, lots of analytics in the back end and ultimately machine learning to start to understand growth and start to alert when something might be wrong, but it's the longitudinal stuff. It's checking and seeing how it's changed and how it's grown over time with a core record over that isn't just it looks bigger than it was last summer, which isn't very helpful. Now, these two are obviously a lot more familiar. The reason I put them in is because this, and actually the sensors on the phone, none of these diseases are isolated and siloed in and of themselves. They're all related to all the other elements of your life. How much you slept, how much activity you're getting, what are you eating, what's the temperature like, what's the context like, et cetera, et cetera. Now, all these sensors, which we actually now take every day, those everyday patterns in our lives, are now able to be tracked and collected on phones, on regular wearables, et cetera. So a lot of those specific things of saying, okay, this is my BG's blood glucose reading for diabetes. What's all the context of that? What is that reading in relation? How's that correlated or caused by my activity? How well I slept? What's the weather like? What's the context of this? Was I skiing that day or was I just hanging around? All of these sorts of sensors around collecting data add the baseline nuance of everything that's specific around the disease. So that's why I've mentioned this one. All right, okay, so now, the last couple of years, all this stuff is cool and it creates a lot of data and it looks good and all the rest of it. But the thing that actually makes it work is this phenomenal change that's happened over the last few years only around our ability to understand data, okay, the data science element of this. It's accelerating, and I'm sure everyone here has heard, this is actually the primary area of competition now between the big giants of tech, okay, which is how do we collect, manage, and analyze data to provide value. So how do we make sense of it? There's two main kind of elements. One, when we speak specifically about health data monitoring, when you start unpicking it and we start having different sources, and we have 15 different sources of steps, or we have 10 different sources of skin things, all these things make for a lot of complexity about understanding how data fits together, and we have 5 different data events that represent one real world event. So it's a bit dull, but the reality is when you start getting terabytes of data about everybody all the time, how that's managed, how that's deduplicated is a huge, huge problem that it takes a lot of computer power to figure out. Out of all this, of course, is the personalized behavioral modeling, right? So how does all of this, it's different for every single one of us, even people who, it's different from each one of us from day to day. So how do you create personalization and models around people's behavior? You can imagine the power necessary to actually figure that stuff out. And of course, integration with health records, right? Not just health records actually, but health records and the massive clinical knowledge and understanding that already exists within the health system. How does all of this stuff actually integrate with it? And how does all of that clinical knowledge, all of that academic knowledge feed in and actually be the rule set for the machine learning elements? From a practical point of view, most of this is actually pattern identification. Machine learning and AI systems are very often about understanding patterns and learning from data as it comes back. So the feedback loop that these provides is critical. So that's saying, okay, I did these 6 things, and here was the result. And then you did these 5 things, and here was the result. And a machine learning engine is something that always is able to feed back into itself and start to understand and build out those patterns in a personalized level. For the academics amongst us, that can be at the individual level, but equally and perhaps even more powerfully at the population level. So if and when we have millions and millions and millions of people who are starting to do this, we start to be able to do population analysis, both for the individual's benefit of saying, people like me did this and it did this, maybe you should try that. This is the primary reason. I actually had a slide, I pulled it for time's sake, but which was at the end of why have we not been able to respond to driving off that cliff? And it's very difficult because the system is very locked. And all the things you're talked about make it so. I've been using this example of, in every other industry I've ever worked in, I could take a piece of a jigsaw and move it 20 degrees, and then it would still kind of fit. Not here. The whole thing has to move 20 degrees. So this is why we're struggling so much this is why we're in the situation we're in, to be honest. The interoperability and standards thing, it's massive. I got a big thing on the challenges at the end. It's huge, right? The integration with EMR systems that they refer to in the States, it's possible. It's just a lot of overhead. So when you have these two, well, you named it perfectly, one track of behemoths, right? And then a bunch of what's been enabled by all this stuff, essentially startups, of which I'm one. This is pure personal, I can't justify the investment of integrating with an EMR right now. I can't. It's too much money. It'll take too long, and I'm connected to the system. So you have these two parallel sort of systems happening, which is very dangerous because, as you're saying, like, I can have this massive data, right? And people are showing up at their doctor with a report that they printed off from their dashboard, and they're going to the doctor, they go, here. And the doctor goes, I don't know what the hell am I supposed to do with this. I'm not paid to do anything with this, which is back to your payer model, because I don't get paid by analyzing this. This is a US-specific model, but I have to chalk up every service I've provided. And if I've given advice from a source that is not accredited as being legitimate, and that advice was wrong, I get sued. So all of these things are massive friction points. There's a lot of great work happening around IT of healthcare, which is the identity management, the security components of that. That's what I mean. So there is stuff happening there, but it's expensive. It takes a long time. It's wrapped in security protocols and regulation, et cetera, as it should be, right? So it's a big friction point is how does all the stuff that we've talked about, because all these ones before are small companies. None of 3M didn't produce any, exception of sort of Google, but they're sort of outside players as well. 3M didn't do this, nor Johnson & Johnson or any of the other giant things. They didn't do any of these stuff, but they were integrate well with things. So friction points, massive. A few quick examples around AI. So this is AiCure. It's a bit simplistic, but it's pretty cute. So they're using imagery to understand medical adherence. So if people have taken their pills, those of you who are not in the medical industry, medical adherence is massive. Huge costs, huge implications. This is basically people not taking their meds as they're supposed to. And we've all done it. You haven't finished the penicillin prescription that you took. You felt fine. You didn't bother with the last 3. This is a massive issue. It's extremely expensive. It costs a lot of death because where if you'd taken the last 3 penicillins, it'd be gone. And instead of the flu, now you have bronchitis and you're in the hospital for 3 weeks. So the costs are exponential over the course of the entire population. This is a shameless plug. So Brook is the startup I have, which is essentially we're building a diabetes chatbot, again, using a fairly complex and growing machine learning engine in the middle, where we're pulling data from everywhere else, and we're starting to be able to really understand all those patterns I'm talking about and deliver insights and recommendations to type 2 diabetics in a contextual sort of chat-based way or conversational UI way that sort of aligns with the cadence of diabetes, which is not something you luxuriate in. It's a bunch of short little, I call them diasodes. It's about 10 30 to 90 second diasodes a day when you try and decide whether to have a banana bread with your coffee, depending on where your BG's at and what else you did, et cetera, et cetera. Which you can get on the App Store, everybody, if you're keen. This one is very early, but I find it kind of fascinating. So this is a ring. It's obviously prototype here, but it's a Parkinson's test to try and understand early Parkinson's. The reason it's under the theme of AI is because it's measuring all the electromagnetics, it's measuring the tremors, et cetera, and trying to build out population-wide, or everybody who has it, patterns to say you are going to have onset of Parkinson's and you can take action. So again, using, I don't want to say big data, but using that kind of muscle and all of the science of AI. I did machine learning stuff literally 15 years ago at uni, right? And it's been the future. It's like I was saying about Brazil. It's the country of the future, and it always will be, right? That's what AI and machine learning was. It always will be the future. It seems now it might be starting to get to providing real value and real world use cases such as this. Finished this one with the two big boys. So this is IBM's Watson, which is being thrown at all sorts of healthcare problems. This is Google's DeepMind. Both of them are very much, at least initially, focused on image recognition and analysis. So you throw it hundreds of millions of images and you get it to figure out what's in there. Okay, so this is very, very, very pure machine learning. It doesn't know what it's looking for. It's finding the patterns within it. At DeepMind, Google's getting extremely heavily into this, and DeepMind have been signing sort of partnerships with everybody from the NHS, where they have access, by the way, to everybody's data. They've signed a deal to get access to the entire database. So we're talking about companies from the data perspective, which are comfortable and capable of ingesting the entire UK health system's database records, all of it. And they can just take it, and they're able to handle that level of data and do stuff with it. So healthcare as a system, as an industry, has not developed, nor should it have, this level of data analysis. So there is an underpinning here of where power starts to lie. And of course, the other thing, in addition to the challenges like privacy, what's the balance between all this stuff? We finished with the challenges, but you're starting to alert, I'm sure, all of you. Okay, so the fourth one of this is, even though we have, so in addition to sort of all these health and wellness products and services, underpinning this is actually a shift, either, no, cause and effect, we're not sure, but a shift towards how people sort of view themselves and starting to measure themselves and quantifying. It got given this term, the quantified self movement, which may or may not be relevant. But ultimately, look, numbers about us are everywhere now. Again, rewind 6 years, 7 years, we didn't have that numbers about ourselves. Everybody's got numbers about ourselves now. Of course, wearables were both sort of went through the Gartner hype cycle of disillusionment, of course, but now 12% are actively wearing them of Americans, are actively measuring themselves every day, all day. And the reason they're starting to grow is because they're starting to actually provide some value. What you measure, you manage. When you see your numbers, you're actually more aware of your behaviors. I don't know which ones of you have felt the same way, but since doing Brook, for example, we measure sleep, right? I've never measured sleep nor paid attention to my sleep duration in my life. Now that it's in front of me, I'm very conscious of it. Now, for good or ill, when you're measuring something, you're managing it, and then I start taking ownership of it, right? So there's a whole sort of market forces discussion to have here, but people increasingly, whether by will or accident, taking ownership of health and wellness data. This is where I'll throw wellness in, because it isn't just, again, sort of very specific health test stuff. It's around wellness overall and how you're living your lifestyle. Again, I'm sort of focusing on the chronic, which is something that doesn't go away. It's something you have to live with. You have no choice. You have to live with your diabetes. You got no choice. So this is a very interesting kind of shift. This is the growth of the wearables market. $34 billion in 3 years and 411 units. Somebody's going around saying that actually by 2020 we'll be putting more computers and more sensors in the laundry than we've ever bought before in history at that time. Okay, so this is happening. IoT stuff, big problem. It shut down the web for the eastern United States recently. Again, massive issues, but this is coming just because the convenience levels are so significant. And there's nothing more beautiful than, this of course has triggered off the infographics and data visualization nerds, because there's nothing more beautiful than looking at graphics of me, Okay, so this one's a little less obvious, but this is actually really, really, really key, which is hardware. Okay, mobile manufacturing and this explosion of mobiles has created an ecosystem which, quite simply, has never existed before for digitally enabled hardware. Okay, the speed with which hardware can be made is exponentially higher. The costs are a fraction. You can iterate fast. The barriers to entry, the capital cost to go and innovate around hardware, digitally enabled hardware, is at a place and has never been seen before. And it is literally in the last 3 or 4 years. The heart of it is Shenzhen in China, where all of your phones are made. And there's an entire area of Bai, which there's endless floors of this. Every one of these little stalls is a component maker for a small, tiny component within the build of materials of mobile phones. So there's a whole hardware startup ecosystem is building around this, because you can go and say, all right, I want to build this thing, and I want 1,000 of them. Okay, you don't need to be 3M to do this anymore. Any of us can go there, and you go to that guy there and say, okay, well, I need this, and I need to plug into this resistor. He'll go, no worries, up one floor over here. He'll get it, and people will just put it together for you. So this ecosystem, these are all mobile components, but this is driving. The reason drones happened was because of this, because people could go and play with hardware. Now, what it means, and if anyone's interested, Wired actually did a great documentary online about Shenzhen and about the ecosystem, the culture behind it, and the Shanxi sort of, which was sort of the replica culture, and how that all built out of this. This is critical from a consumer point of view, because this is what a glucometer looks like as created by 3G. Sorry, GM. It's ugly, but most importantly, it's siloed. It does one thing. It's not connected in any way. This is what a new startup is doing right now because of Shenzhen. OneDrop, it's a diabetes star, as I used to say, they're a competitor of ours. It's beautiful, it's stylish, it's connected, it's integrated. You can go and make one of these for not much money, and you can make them, and you can iterate through them, and you can get small batches made. So if you start thinking about what's the driver of all this stuff, healthcare is an extremely personal thing, right? Diabetics got to carry this thing around with them. So that's the one that you go to the bathroom stall to do your glucometer testing in, and this is the one that you do it at your desk. Right? And the fundamental change for that, culturally and acceptance-wise and ownership of it, changes everything. This is what a home connected with a bunch of stuff. This is what a home sort of EKG or like stethoscope is. This is an Australian company, Stethi. Wireless, it's beautiful. It has a ring of light that shows the information, giving feedback of where you're putting it, connected with a beautiful app, etc. You've seen this one before. That was a home blood pressure test. That's what it looks like now. Okay, so you start to see how this actually is enabling all sorts of innovation around the hardware and around the monitoring. Okay? All right, the last one is a little more amorphous and dear to Vince's heart. So the last 10 years of consumer technology, consumer products and services has taught us a lot. It's taught us a lot about design. It's taught us a lot about interfaces. It's taught us a lot about experiences and behavioral modeling, engagement, context, all of these things. That's why most of the stuff you're using on your phone is actually pretty good, right? That's iterated through, and there's all sorts of lessons. That is not an example of one, right? So one of the key drivers, from my view, of digital health is our ability to take all these lessons of consumerization and apply it to something that hasn't had customers at the center. It's had patients at the center, and it's had patients as an avatar about data and tests and all the rest of it, but it hasn't viewed it from the customer's perspective. Now, that can be argued. Lots of people inside will say, well, that wasn't the primary, and nor should it have been viewed as beautiful, as being more important than effective. I agree with that. But we're now at a point where all of these lessons can start to be applied to healthcare, and particularly distributed healthcare around chronic.